When patients meet me for the first time, I want them to feel the most comfortable, and I want them to trust me as their provider. Everybody's experience at my office is different, and people sometimes come in anxious, or sometimes people come in hostile and they don't want to be there and so forth. But my goal is to create a peaceful, good environment for the patient to feel the most comfortable in. And I want them to trust me as their provider, and I want them to, keep seeing me. So I don't want anybody to fear me or anybody to not come back and not see me because they didn't like me. So the goal is to get everybody to like me. And I think I'm a likable person. But, sometimes patients can have a lot of dental anxiety, and sometimes, that can draw them away from the dentist, and they can come in very hostile, and they can come in not wanting to talk to the provider. And when my patients are established in the office, I like to try to make them feel as comfortable as possible and, reassure them that I'm on their side and I'm on their team and I want what's best for them, and so does the whole office. When people come in for smile transformations, or they just want to feel more confident in their smile, I think we really break it down to what the patient wants and what's the best outcome for them. There's different types of treatment plans out there and different types of things that we can do for these people, but it's just finding the right, solution for that patient. And whether that's, brainstorming with other doctors or, discussing with different surgeons and whatnot, and kind of putting all of our heads together to come up with the best possible outcome, I think that's the most important thing. And that's the goal with any smile transformation, is to make you feel as comfortable as possible, do what you want to do, and also what we think is best, so that you can feel confident again. When people come in anxious, or people come in after a long time of not seeing a dentist, I found it really difficult to break that barrier in the beginning of my career. But I kind of realized what I was doing wrong early on in my career, and that was just not listening. And I think that's the most important thing, is listening to your patients, listening to what happened in the past, why their dental anxiety started, what kept them away for such a long time, why are the kids fearful? There's so many things that draw people away from the dentist, and I think it's important to just listen. And if we listen and we are understanding of our patients' feelings and their past trauma, and if there's things that we can do to make them comfortable, whether that's, sedation, or whether it's nitrous gas, or whatever it may be, those are all things that we need to take into account when we're discussing options with these patients. Because if we just go in there and just say, oh, you need 1, 2, 3, and that's it, we walk out of the room, where's that? We're never going to cure that anxiety. We're never going to cure the fearfulness from the dentist. So I think it's really important to just sit down and talk with our patients and, get an idea of what happened to them before and what we can do to make the experience better for them. And I think that's my strong suit. I think that's what patients really like about me. And I've been told that I do really well with people that have anxiety. And I've transformed some people and not fully cured their anxiety, but we've lessened it to the point where they can at least get into the dental chair without having to be nervous or be anxious about getting work done with me. And I think that's a big accomplishment for sure.